Welcome to this explainer. Think about the dashboard of your car for a second. When something goes wrong under the hood, a tiny light flashes to warn you, right? Well, your body has its own set of check engine lights for your cardiovascular system. And surprisingly, they're located at the very farthest outpost of your body, your arms and legs. Today, we're playing medical detective to decode exactly how to read those signals.
So let's jump right in with a pretty fascinating question. What can your fingertips and toes actually tell you about the hidden plumbing inside your body? You might think a heart problem only ever shows up as chest pain, but the truth is the health of your central pump dictates the health of every single distant vessel. By examining the skin, the temperature, and the pulses of your extremities, we can uncover a massive amount of information about your overall blood flow, cardiac output, and vascular health.
Here's our roadmap for today. We'll start with the upper branches of the arms, move down to the lower branches of the legs, figure out how to diagnose the culprits, arterial versus venous, and finish up with prevention and foot care.
Starting off with Section 1, the upper branches, examining the arms.
It is actually incredible how fast a healthy body operates. Try this. Give your nail bed a quick, firm pinch. When you blanch that nail bed, you're forcing the blood out. But the moment you release it, that healthy pink color should return in just 1 to 2 seconds. That right there is called capillary refill. It's a direct, real-time index of your peripheral perfusion. If it takes longer than a second or two, well, we might be looking at decreased cardiac output from conditions like heart failure or shock. It's a split-second test, but it has massive implications. Next up, we literally feel the rhythm of the plumbing. By palpating the radial pulses on your wrists, we grade that force on a 0 to 3+ scale. Now, a normal healthy pulse is a solid 2+, but if we feel a 3+, that means it's bounding, which is something we'd expect with exercise, anxiety, or maybe hyperthyroidism. On the flip side, a 1+ means a weak, thready supply line, often pointing to shock or peripheral artery disease. And a 0? That means the pulse is completely absent, warning us of a severe occlusion.
Now, this brings us to a really cool step-by-step mechanical process called the modified Allen test. Imagine you need a procedure that requires placing a tube into the radial artery of your wrist. Before we ever even consider doing that, we have to be absolutely sure the other main artery in your arm, the ulnar artery, can supply enough blood to your hand all on its own. So we firmly block both arteries, have you open your hand, and then release just the ulnar side. We're watching for a palmar blush, basically the pink color returning to your hand in under 7 seconds. If it stays pale, the collateral flow is blocked, and we definitely need to avoid that procedure.
Moving right along to Section 2, the lower branches, investigating the legs. Down here, gravity plays a huge role in the plumbing, making your legs a prime spot for vascular issues to show up. The crucial point is that both your legs should be roughly the same size. If they aren't, we pull out a tape measure and measure the calf at its widest point. An acute, painful asymmetry of just 1 centimeter or more is a major red flag. It's actually our first big clue to suspect a deep vein thrombosis, or DVT, which is a clot in a deep vein. It can also point to lymphedema. Basically, we never ignore a swollen asymmetric calf. Now, if we do spot some swelling, we need to know exactly what kind it is. We firmly press a finger into the skin right over the shin bone for about 5 seconds. If it leaves an indentation, we call that pitting edema. We grade this from a mild 1+, which just leaves a slight indentation with no obvious swelling, all the way to a deeply distorted 4+, where the indentation lasts a long time and the leg is grossly swollen. Seeing bilateral pitting edema like this often points us towards systemic issues, like heart failure. A good medical detective also has to check all 4 major supply lines in the legs to make sure the pulse is making it all the way down. We start at the femoral artery in the groin, move to the popliteal artery behind the knee, and then the posterior tibial artery right behind your inner ankle. Finally, we check the delicate dorsalis pedis on the top of the foot. That last one is tricky. It requires a super light touch. If you press too hard, you'll actually just feel the pulse in your own fingertips. Finding all these pulses confirms the highway is open all the way to the toes. Let's see how we can actually use gravity to test the system when we suspect an arterial deficit. First, we elevate the patient's legs about 12 inches off the table to drain off the venous blood. The skin should stay a healthy pink. If it turns noticeably pale, what we call elevational pallor, that's a strong indicator of arterial insufficiency. Then, we have the patient sit up and dangle their legs over the edge. If the feet turn this deep blue-red color, known as dependent rubor, it tells us severe arterial insufficiency is present. The chronic lack of oxygen causes the vessels to lose their tone, so the blood just pools there. Which brings us to Section 3, diagnosing the culprits, arterial versus venous disease. Your plumbing system has two distinct sides. The supply lines bringing oxygen-rich blood down, those are your arteries, and the return lines carrying waste back up, which are your veins. We absolutely have to distinguish between these two because the symptoms are totally different. Arterial disease starves the tissues of oxygen. It causes intermittent claudication, which is this deep, painful muscle cramp that literally feels like your leg is suffocating. Venous disease, though, is a failure of the return system. Blood pools in the lower legs, causing a toxic backup of metabolic waste. So instead of a sharp cramp, you feel an aching tiredness and a heavy fullness in the calf. Notice how the aggravating factors contrast perfectly here. With arterial disease, elevating the leg causes excruciating pain. Why? Because you're forcing the already blocked arteries to pump uphill against gravity. Activity also hurts because the muscles demand way more oxygen than the blocked arteries can actually supply. But with venous disease, elevating the leg actually relieves the pain because gravity is finally helping drain that pooled blood back to the heart. For venous patients, it's prolonged standing or sitting that causes the agony. Even the physical footprints, the ulcers, look totally different. Arterial ulcers look exactly like what they are, tissue that has died from a lack of blood. They're dry, pale, and look perfectly punched out, almost always showing up on the tips of the toes or the heels. Venous ulcers are the exact opposite. Because they're caused by increased pressure and fluid leaking out of the veins, these ulcers are shallow, weeping, and have really uneven, irregular borders. They almost always form around the inner ankle. Now, beyond just the arteries and veins, we also have to look out for lymphedema. This is a chronic accumulation of protein-rich fluid in the tissue spaces. And unlike the pitting edema we talked about earlier, lymphedema is usually non-pitting. It actually feels hard and brawny to the touch. We see this condition very frequently following breast cancer surgery or radiation therapy, where lymph nodes have been removed or damaged. Early detection is absolutely vital here to prevent it from progressing. And of course, we can never, ever overlook an acute DVT. This is a true medical emergency. A clot in a deep vein can break off, travel to the lungs, and become a fatal pulmonary embolism. DVT is driven by Virchow's triad, 3 classic factors that promote clotting. First, stasis from immobility or prolonged bed rest. Second, hypercoagulability, meaning the blood is just more prone to clotting. And third, endothelial dysfunction, which is damage to the vessel wall. If someone has sudden, intense, sharp, deep muscle pain and a swollen, warm, red leg, DVT is our #1 suspect.
Finally, Section 4, empowering your plumbing, essential foot care. It's one thing to diagnose these issues, but it's another entirely to prevent them. You can actually empower yourself right now just by establishing a daily foot inspection routine. Because your feet are so far from your heart, they're the very first to suffer from poor circulation. Take a mirror and check the bottoms of your feet daily for red spots, cuts, or blisters. Wash them regularly, gently dry between the toes, and always trim your toenails straight across. That simple act prevents ingrown toenails that can quickly turn into the severe ulcers we just looked at. But above all else, you've got to keep those supply and return lines flowing. Walking is arguably the single best exercise for your vascular health. Your calf muscles literally act as secondary pumps to push venous blood back up to your heart. Stuck at a desk? Rotate your ankles, or try writing the alphabet from A to Z with your feet. Stand up every 30 to 60 minutes. And hey, if you catch yourself crossing your legs right now, uncross them. You're pinching a vital hose in your body's plumbing system. This matters immensely, especially if you're dealing with diabetes. Diabetic neuropathy is a silent threat that strips away the foot's protective sensation. It means you could step on a tack or have a shoe rubbing your heel raw, and you just wouldn't feel it. This lack of pain completely hides repetitive stress injuries until they become severe, infected ulcers. Because of this, a staggering 75% of lower extremity amputations occur in people with diabetes. Vigilance is absolutely critical. To wrap up this clinical journey, I want to leave you with some really direct wisdom from the source material. We don't often think about our feet, but good foot care can prevent serious problems later on. Keep the blood flowing to your feet. It sounds so simple, right? But diligent, daily foot care is truly your absolute best defense to keep that vital blood flowing flawlessly. So, I'll leave you with this. Armed with this new knowledge, how will you protect the delicate plumbing that keeps your whole body thriving? Next time you wash your feet or check the color of your nail beds, remember that you are looking at the distant outposts of your heart.
Treat them well, keep moving, and pay attention to those warning lights. Thanks for joining me on this explainer, and keep exploring the incredible systems within you.